I'm Dr. Tilman Humpl. I'm the director of the Pulmonary Hypertension program at the Hospital of Children, so basically covering the province of Ontario. Today I'm going to chat a little about transition of pediatric patients to adult counterparts. If you look back in the 90s, when our colleagues from oncology were already busy publishing their results, their experiences in transitioning pediatric patients to the adult medical environment. This was a time when prostacyclin just hit the ground as a potential treatment option for pulmonary hypertension. So we are clearly lacking behind. And I remember when I took over the pulmonary hypertension clinic from Dr. Ian Adatia, it was a very small number and a lot of patients were diagnosed late. We didn't have the full treatment options that we have now, and 20 years later, we are actually really able to bring a lot of these kids to their 18th birthday, and this is usually the transition when they go to the adult world, at least in our institution. What a lot of these families and patients experience is there's a lot of trust initially over the years that you build in the pediatric institution, and then out of a sudden at age of 18 they have to transfer it over and things go different in an adult institution. There's not anymore a relationship between the family and the physician. It's more a partnership between the adult caretaker and the patient. Parents are being a little bit left out. Procedures are being done in a different way. And this is something that there's a lot of anxiety for these patients and families. And what we try to institute over the past couple of years is that we either have, if it's only one patient who in a certain time frame moves across the street to the university health network, that we have the team, one or two of the physicians or one or two of the nurses coming over and have a combined clinic, or we do a sort of transition workshop where we have a couple of kids and they all bring their families, and we have a day long where basically the handover happens without going into detail about the medical history. But this is a graduation for these kids, and they're quite happy. They get a little certificate, and then we all wave goodbye. And most of the time the parents are more concerned because they lose also a little bit of control. Usually these teenagers are pretty cool. They're not very stressed about it. It's more the parents. But I've seen both, and some of these kids, 16, 17, 18-year-old, they also want to get out of the pediatric environment. So it's actually quite interesting. But they don't know exactly what they're facing. It's a new chapter in their life. So, and sometimes we transition a patient already at 17. Recently we had a patient who most likely is going to be listed for lung transplantation, and then we decided to do the transition a little bit earlier. And this was actually around the time where also something happened that's cool. If you have somebody who's really advanced in development, I start sometimes 13, 14 years of age, make more eye contact. At some point we also discuss making the clinic appointment with the patient and not to the schedule to the parents. But it also depends a little bit on the frequency of visits. We see these patients. If there's a patient who comes back to our clinic every 3 months, it's a little bit a moot point to start the transition at the age of 14, and it's maybe more in the 16, 17 range, because we still have 10 to 12 visits ahead. But if it's a patient who comes only every 6 to 12 months, then we start a little bit earlier. But again, it's an individualized process. There's no protocol that we strictly follow. Not every patient can be cured. Despite maximal therapy, despite listing for lung transplantation early on, death on the waiting list. But it's clearly we have more and more patients being transitioned to the adult programs. It brings a lot and means a lot to me that we are able to transition kids and make them live longer and partially live a normal life. It's a very gratifying feeling. My name is Dr. Tilman Humpl, and I'm aware that I'm rare.